So today we are going to work on breathing, mobilizing the ribs, and then working around the muscles that go around the ribs, including the lats and the shoulder blade stabilizers. The first is to practice breathing. So with breathing, there's 3 different areas that should move: the belly, the outer ribs, and also the chest. A lot of people emphasize that belly breathing, which is great. However, we need to also be able to move through here and through here. And so to do that, to assess it, you can lay on your back with your knees bent. You're gonna have your hands at your belly. You can take a deep breath in. You should feel expansion outward, like a balloon. The lungs are filling with air, and you should feel it expand this way, and this way. So I'm gonna breathe into it. And trying to make my exhale as twice as long as my inhale. And I'm gonna feel movements happening, or maybe I'm gonna notice, oh, I can breathe through my belly just fine, but this is locked down. Or, oh, I can move through this just fine, but I'm not really feeling any back and forth motion into my rib cage. So you're going to lay onto your side. Let's say you have a side that is tight. You can relax your head. It can be propped on a pillow. And then you take a deep breath in, and you're gonna feel expansion outward. As you exhale, you're gonna feel it in. So you're gonna breathe into your own hand that's pushing at your rib cage. And you can also bring the arm overhead. That's gonna stretch out and open up through that side, and practice breathing there. After about 10 breaths, try it on the other side, and then compare again, laying on your back, to see if it's moving a little bit differently. Once that's clear, we can do some releases for the diaphragm and the belly. If we're holding, if we're guarding, let's say our muscles are sore, or just we can kind of get locked down right here. So you can take a Pilates ball, and there's several ways you can do it. You can lean against it, sitting, and breathe into it here. And when you breathe in, you'll feel that pressure increase in the ball. And as you exhale, you'll feel a movement away from the ball. Breathing in, you'll feel that pressure increase. And exhale, you'll feel a nice resting return. You can do this here. You can do this in a modified child's pose position where you're here. Notice I'm not all the way forward. But I'm propped, and this is supported and secured, and I feel that pressure as I breathe in and out. If I feel like one side's tight, I can shift it slightly to one side. I could shift it to the other side. The last position that you could do this in, if you're comfortable and you're laying on your back, is you can pull your knees in toward your chest and keep that pressure in your knees as you breathe in and out. Once you are done with that, you might feel like you can move your ribs easier. You will feel better activation of the core and the pelvic floor as well.